Hello, everyone. Welcome to our fourth and final workshop, of STEMathon X 2.0 Day 1. Today, we're joined with Miss Hyerin Kwon. Could you explain a little bit about your profession and what you do?
I'm sorry, I had a little trouble there. Okay, so before I begin, let me introduce myself. My name is Hyerin Kwon. I'm a registered nurse in California. I'm currently working as a assistant director at a skilled nursing facility. So what I do is I'm a nurse. So being a nurse, there's so many responsibilities, right? So taking care of patients, all that. So there's so many responsibilities that a nurse can hold. But the big picture of being a nurse is advocating patients, educating them, providing care to individuals, and supporting patients through their illness and health. But there's so much more, like assessing patients, administering medications, monitoring signs and symptoms, operating medical equipment, performing diagnostic testing, following up with doctor's orders. But these responsibility comes to the conclusion on providing the safe quality care to those who need medical attention, right? So that's what we do as a nurse.
Yeah. So as you mentioned, nurses have a huge responsibility, and you even went in a little detail about what those responsibilities are. But as everyone knows, COVID-19 impacted like everyone in the medical field, especially frontline healthcare workers such as yourself. So could you kind of explain how COVID impacted your job?
So I guess at my facility, like I would say, like during January and February, we had an outbreak. So during the peak of COVID outbreak, I was working the bedside nursing. Currently, I'm holding my position in the office setting, but I was working in the bedside nursing. And I mentioned earlier, like all these responsibilities. On top of that, we had to, our main focus was just keeping the patients alive. So whenever I walk into the facility, get my reports, and then making quick rounds, I can find bodies that who are not there, like who has passed the previous shift, and there's so many patients who are passing away. So these were so hard to see and experience as as a nurse and as a human being. But during COVID outbreak, our main focus was just keeping them alive, just providing the best care we can, as they're holding their last, breath. So being in the medical field, it just impacted so much in reality where we just had to deal with, and then and just keep thinking that this will pass at some point, and just keep move on and move on, and just being a COVID nurse, it was just so stressful dealing with like shortage of staff and shortage of supplies, and especially patients who are not, I mean, of course there were patients who got better and got discharged safely back to their loved ones, but just seeing them not making to the point where they cannot survive, and just seeing all these signs and symptoms that we just heard from news or from the social media, that we can actually see with our physical bodies, that they cannot. Some patients didn't even have a signs and symptoms of having a COVID, like they were breathing fine and their O2 sets were good, but the patients who just passed away because their lung just failed so quick. So being a COVID nurse, we could actually definitely see that there was something going on in the air. And then it just impacted the nurses' lives too, where they had to deal with all this stress because they're the one who made off to make difference in their lives, in patients' lives. So those were just stressful time, but we're making it. So
Yeah, medical workers, especially nurses, have had a tremendous responsibility during the COVID-19 time. And yeah, we can definitely understand how much you had to go through. So now talking about you just like you talked about COVID-19 and how it had an impact on your day-to-day life. Can you just describe like what your day-to-day life looks like as a nurse?
So it would have been a normal days. We just we report on, you know, and these days we had to whenever we're coming into work, we had to like physically and mentally be prepared, like literally be prepared to face what we are going to face that day. And we just receive reports from the previous shift nurse if any changes had occurred or any new doctor's order were made, any appointments that the patient has, any procedure that needs to be done. And then we go into patients' rooms and just make sure that they're comfortable and they're okay. And if they feel safe being in the hospital, because the hospital settings are where mostly the disease are can happen. And we just have to like make sure the patients feel comfortable and safe in like under our care. And we administer medications, we assess patients, and then if there are new signs and symptoms occur, then we have to communicate with doctors and other coworkers. And a lot of team members that we have in the facility that we have to communicate with them as well. So everybody can be on the same page. And we also provide basic ADLs. ADLs are activities of daily living, like brushing their teeth, washing their face. We have to, give assistance to patients because we want to make them feel that they're cared for. So that's what we do. We, give them bed bath, or we give them shower. We also have aides who are helping us, like nurses. So from getting help from them, we also assist patients in that matter. And we also follow up with doctor's order if anything has to be done that day for the patient. And then throughout the day, we just keep on, answering call lights and meeting their needs, medical attention. And then when it's time to go home, we just report off and come back the next day being prepared again.
Yeah, that definitely sounds like a very eventful day, and there's probably a lot of changes when COVID came along. But now we want to backtrack real quick. We have a question. You want to backtrack all the way to like high school, and so can you talk about the path you took to reach where you are, like say starting from high school all the way up to now? And were there any difficulties you faced?
I would say the most difficult thing was the nursing school, of course. There's not really a special path one can take to become a nurse. I mean that, what school you went, or like what courses you took, how many hours you completed in clinical setting. It's all about providing the best care possible with your heart, right, to the patient. So for me, I went straight into my Bachelor of Science Nursing, like Science in Nursing program, so BSN program. And then right after high school, and then I got my master's degree in nursing education, and now I'm in an office setting, mostly dealing with documents and papers. But of course, there just to pursue a nursing, of course, there are so many obstacles, and there were in my life, the pulling from the being a nurse, because it just takes so much passion to take care of others. And the hardest obstacle I have faced is when nurses are not appreciated for what they do. What they have done for the family members and the patient themselves, and then at the end it just like leaves you with nothing. Then that's the most hardest thing, that being a nurse. But I would say the most besides being a nurse is, I would say, like, it's rewarding, just because you can actually see patients get better, and then I think it's just the idea that I made an impact and a difference in their lives.
Yeah, and I'm sure a lot of these impacts were able to be seen during the whole COVID situation. And I just want to go back to COVID because I feel like that's a very hot topic right now. So I'm aware that a lot of nurses' hours went up, or their work hours like skyrocketed up from usually 8, maybe 9 hours per week to around 13 to 14 hours per week. So did you see your workload increase? And if so, how did you manage that?
Of course. Because of a workload, I would say the most difficult thing that we face as a nurse is a nursing shortage, like a staff shortage. We did not have a nurse who are going to come in the next shift who will endorse my report and then take care of patients. So I had to, there were some days that I had to stay back a little bit and, just pick up some overtime hours. But of course, it's all paid for, but you're physically, mentally just tired. You just want to get out of there and you want to go back to your, house. But um, and then I would say the supply shortage was the difficult thing, because you are picking up overtime hours, but there's no IV fluids that you have to hang, because patients are dehydrated. You have to hydrate them, but in the blood pressures are going down, and you cannot maintain them because there's no supply. That's the difficult thing to see as a nurse, and then it was just so stressful because you can tell that like patients are not cared for because of like because we are shorter nurses and the staff. And I would say the most hot thing that just appeared during COVID season was travel nurses. So we had to use many agencies throughout California, and then we had to call for nurses who are in travel contracts so they can come into our hospital and then just work with us and for us so that we are covered. And as an administrator, we had to like make sure that these nurses will come in to work on time and pick up their shifts, because of course nurses are tired, they're human beings too. Even if they have like compassion and then this passionate heart for patients, they can grow tired and they don't want to come into work, they want to call in sick. That's okay, but we just had to make sure that the staffs were covered, and then staffs were appreciated, and so that our patients are cared for. So those were really hard.
Yeah, for sure. So I'm gonna go back to what you just said, like a couple seconds back, about bringing in nurses from outside, maybe from other industries or all of that. Could you kind of explain how that process works a little bit more in depth? I found that super interesting, but I'm not entirely sure how that would work because when you're bringing in new nurses, wouldn't that take a toll on your hospital's expenses and all of that? So how do you manage all of that if you know?
Of course, educating new staff, that costs so much, so much time and so much money. Orienting, like because we're paying them during their orientation days, and and then we're not getting help because they're still in orientation. But most of agencies and travelers are experienced nurses. If they are not, if they don't have enough experience, the travel agencies and the other agencies won't hire them. So most of the workers, like nurses, are experienced ones. So whenever they come in, they don't. We try to look for nurses who are, like familiar with what the computer system that we have, so they can catch up quickly and then pick up their shifts as soon as they can. So of course, orienting them to the new floor and then just showing them around, like that can take a day or two. But if the nurses are experienced and then they know how the computer works, then the computer charting systems are work, then it wasn't too much a problem, and it wasn't too much a hassle to use their manpower to our facility.
Okay, I'm gonna go back to the topic of mental health, like you just talked about. couple of minutes ago. So NBC has reported that nursing is an incredibly stressful career, like you just talked about, and many people deal with burnout. And you also mentioned that COVID-19 has required hours to go up. So how have you like dealt with all of this and formed a work-life balance and stayed mentally at peace during such challenging times?
Of course. So I think there was a point where California government was offering, all of healthcare workers to be paid little more per hour. So individual people will have their hourly rate, like set rate, but the California government was, um, was asking hospitals to raise their pay. So the nurses will be appreciated, and then, so they can continue to work and not feel burnt out. And then, like other companies, like the corporates are working towards like giving them bonus or, like appreciation bonus, or if they pick up shifts in COVID unit, then, after a certain time, then they will receive a little bit more of, monetary, you know, rewards. So I would say, money is not all about, being in a, like giving care to patients and then being passionate, being a nurse. But I would say that has helped a little bit, for nurses to pick up a little more shifts and, stay a little bit back to complete their hours, and then and getting, help from them. So also there was time where like our facility has kind of allowed nurses who picked up shifts, like who worked in a COVID unit, then they will allow a little more of, paid time off kind of thing. So, like the corporates and the government, so whoever are in administrating field, they are trying their best to give a little something, to nurses, like reward them with something that, that so we can appreciate them for what they do.
Yeah, I agree. I think mental health and appreciation is really important in any career, not just nursing. And talking about career choices, since like, I mean, what would you like say to inspire people to become nurses during this COVID time, especially since hours went up and some of like the positives being a nurse kind of went away because you have to work for so many hours and it's really stressful. So what would you say to inspire people to become nurses?
So I would say, because I was a nurse and then I faced the COVID, that wasn't too much a problem for me. But whoever is thinking about becoming a nurse, like facing the COVID on their way, I would say, I don't know. I think it just takes too much compassion, and then, like, and patience in their hearts, and then, what they have to face. Hold on. So, I don't know. I just have, like, I kind of feel bad for the new upcoming nurses who are facing the COVID, because it wasn't something that, they planned. It's just something that happened in a world that, they have to face, right? So I would say, if you are thinking about pursuing career in the medical field, or, thinking about becoming a nurse, bedside nursing is not all about nursing, right? Like, bedside nursing is not only nurses can do, they can also go into different fields. So I would say, like, you can also take alternate routes to become a nurse, right? You can, you can sit in the office setting, you can do something like a case managing, or you can do educating job. You can also do like, or you can go into like a little more school, and then you can teach students, right? So those things, I don't want to say that, don't be afraid, becoming a nurse to face COVID. But during COVID, amidst the COVID, there's a lot more you can do as a nurse. So yeah, so I wouldn't want to say like, oh, don't become a nurse, because, like, these are the things that you have to face during COVID. I want to say, like, there are more opportunities that you can face or you can do as a nurse during COVID. even with, even with COVID.
Yeah, there's a lot of opportunities with COVID, but at the same time, there's a lot of downsides. So it's really just based upon how much passion you have, which is
Right.
something you really brought up really well. So thank you for that. I had another question about COVID. So
Mhm.
my mom also works in a hospital, and she said that when COVID first hit her hospital, she was a little not really like scared, but there was like kind of a scare around around the hospital about COVID spreading, people getting it. There was all of these this protocol established to kind of prevent that from happening. So, do you have any thoughts on like all the protocol? I'm pretty sure nurses had to wear like this whole suit, this hazmat suit
Mhm.
with all sorts of facial protection and all of that. So, did you have to experience any of that, and what are your thoughts on all that?
Yes. So it was during winter time when this COVID outbreak happened in my hospital. It was cold, but wearing all these gowns, all these gears around your head, and eyeglasses, and all these protective gears, it just makes you sweat. So you go into patient's room. Each patient you have to have a different, like individual uh, gowns. So like for example, like if there are like two patients in the room, you're caring for this patient, you have to change out inside the room, and then wear new the gowns, equipment, everything, and then care for this patient, even if they're in the same room. So wearing all this equipment is just at first, I would say at first it kind of bothered us being, to provide care whenever we're providing care. So because it's on the way, all these gowns, it doesn't really fit you. And then all the masks that you have to breathe in and out, you can't really even, like you just have to deal with your own breath all day long. So in the beginning, it was a little bit of, hassle, to work with additional equipment. But at the end, you just have to think that, like we took an oath to take care of patients with our best care and with our best knowledge. So even if it wasn't bothersome, but we, like I guess like it just came to our, physical body that we have to accept it and then deal with it, So at the end, nurses were really fast at, putting in and off, so I don't think it didn't really matter to nurses at the end. Towards the end of the outbreak, I would say, they always had the gears on all the time. And, look at the masks and then the gloves and the gowns, they were just really quick, donning and doffing, so it didn't really matter and bothered us when we're providing care to patients.
Yeah, that makes nurses seem like superheroes, the way they gotta constantly keep on changing equipment, putting on new equipment at a very fast rate and at a very effective rate as well. So that's really, really interesting, and we really thank you for all that. I had one last question about all this protocol, and then we can head into some pre-submitted questions, which Mahir will probably get into. Um, I'm sorry, one second. Yeah. When you were doing all of these like changes in equipment constantly over and over again, were you ever exposed, like not, I don't want to say exposed, but were you like kind of more open to like COVID patients or people who have COVID and like be put at higher risk when you were in the middle of changing?
Yes. Yes. So if you are in the setting and if you are in the environment, because they kind of isolate you, right? The hospital itself kind of isolates you in the unit. So you kind of lose that, fear where the COVID will, get to me. So, but of course, we still did, like really good hand washing in between patients and hand gels all the time. Whenever, like we were doing one thing and then hand gel and then the other thing hand gel. But at the end, I would say because you are in the setting, you kind of lose that fear where, like, oh, I might get COVID and, during donning and doffing and, like I might get sick and all that. But it kind of, got to us where, like it is what it is, So if we get it, then we get it, and if we can overcome. The COVID didn't really scare us. We can definitely see that it is there, but it didn't really scare us at the moment when we are working together. Because you have a support system, like your coworkers are there for you, and then they will constantly remind you to use hand gels and then hand sanitizing, and then like washing hands really good, and like washing your ears, like your face shield and your eyeglasses every day before shifts and after shifts. So with the support of coworkers and like the appreciation from the hospital, that just constantly remind us that we have to be careful. And yeah, so it was a good time for nurses to experience.
Yeah, and continuing on the topic of COVID, we had in a private message of a question. Someone asked, has anyone stepped down as a nurse because of COVID, or like being scared of getting COVID, like especially if they were elder?
Of course. So we did have 4 experienced nurses stepped down and stepped out. They resigned actually. When the outbreak happened, these 4 nurses, they just, like, we don't want to deal with patients who are, like who has COVID, and then I don't want to be trapped, isolated into the unit where like I might get COVID. So yeah, there are nurses who just stepped out. Like, of course, even if we, when we started our career as a nurse, we did take an oath to take care of patients no matter what happens. But we're still human. We still have feelings, and we still are scared, and we get tired. So there are nurses who just resign, but that's okay. We don't want to judge them because it's their choice, and then it's their right to do so.
Yeah, and I definitely agree. Yeah, you can't really judge someone because the COVID pandemic was so unexpected. So no one really wants to take the risk. And we have one last question from the private chat. Someone asked, what are the good qualities of being a nurse if you want to be a nurse?
Good qualities. I would say being compassionate, being patient, have a little more empathy than usual, other people, more sensitivity towards others, have a good critical thinking process, skills, all that, to take care of others who, especially who are physically and mentally ill, because it just takes a little more extra to be with them and to deal with what they have. And it's not what they expected, and then it's not what they planned. Like nobody plans, oh, I'm gonna eat so much, and then like I'm gonna have a diabetes. It's not what they plan to do, and it's unexpected for them too. So as a nurse, as a profession, you just have to have a little more of compassionate heart, being more patient with them. Also, to be a good nurse, I would say like be flexible and don't panic and don't give up easily, because just there's so much into nursing. Like there's so much things that you can do. So if this doesn't work out, then just go in the other way, and then just find an alternate way to deal with it. So I would say like don't panic, don't give up so easily, be flexible.
Yeah, those are some great qualities, which not only nurses, but I think all healthcare providers should really have, especially patients, because a lot of patients like are really, I don't want to say annoying, but like they could really get on your nerves at times. So you have to
Right.
make sure that you can tolerate them to give them the proper care you need. Okay, so it looks like we're reaching about the end of our workshop. Thank you so much for being here. If you have any or if you have any last statements you'd like to share with the audience, then I think right now would be a great time.
I would say, because since I'm a nurse and we're talking about the nursing profession, let me just, let's just talk about the nursing side of it. So my advice for people who are thinking about going into medical field, or, pursuing their career as a nurse, because this profession can suck your energy out so quick. and then it will burn you out so easily. So I want you to start, like as a student, young students, I want you to start assessing yourself and then see how you deal with your stress and how, like what are your good coping mechanisms, and like, because I want your inner self to be firm and strong, and train yourself, like if something comes up in your lifetime, then just deal with it, and because there are so many ways that you can take. And my another advice is that if a person thinks about nursing, then they mostly think about bedside nurse. But I'm in the office setting, mostly dealing with documents. They can also, go into once they get their nursing license, they can also go into like different fields. Like they can become a flight nurse, they can become a dialysis nurse, and like legal counsel nurse. You can also become a nurse practitioner. Like working in a surgery centers, like midwife, case manager, and all that. So just don't think about bedside nursing where it might stress you out because all these things like the pandemic is going on. Just think you can also become something else being a nurse. So don't get scared. Don't let COVID bother you.
Yeah, so that's some great advice for everyone who wants to be a nurse in the audience and anyone who's watching at home from the YouTube. Yeah, that seems to be the end of our time. Thank you so much again for attending. It really means a lot to us. And I think we all learned a lot about nursing, nurse life, and the COVID pandemic as a whole. So everyone, we will have more workshops tomorrow. You can check the schedule or the info doc and feel free to join any of those. Well, those are also going to be some pretty great workshops. And thank you again, Ms. Hyerin Kwon, for your time here.
Thank you.